Welcome, everyone, to OB Clarity with Dr. Godfrey. I'm Dr. Godfrey, PhD RN, and today we're on episode 11. I can't believe this is my 11th episode. And the title is When You're Stuck Between Two Answers, Mastering Priority Nursing Questions. That's right. So we're going to tackle that challenge that trips up so many nursing students. So you know the feeling. You've narrowed a question down to the last 2 or 3 options, and now you're staring at them thinking, which one is right? That hesitation, that's exactly where your critical thinking is being tested. When you see the word priority, your brain should automatically switch to safety mode. Nursing is always about protecting your patient from harm first. Before second guessing, how about you ask yourself, which action keeps the patient safest? So I like to teach students a simple word to guide their thinking. SAFE. S-A-F-E. So when you're stuck between two answers, run them through this filter. Your S, safety and survival needs first. So which answer prevents the greatest harm? Airway, breathing, circulation. That's our ABCs, always going to come first. That's safety. A, assessment before action. So if one answer is assess and the other is intervene, usually you're going to assess first, unless there's some immediate threat to your patient. Then F, focus on the patient, not equipment, not staff. Always put your attention on the patient. If one option says check the monitor and the other says check the patient, please go see the patient, check on them, okay? So that's our focus on our patient. And then E, evaluate the outcome. So which answer leads to the safest, most stable patient outcome? So think beyond the immediate symptom and consider the long-term stability with your patient. How about we try a real OB question together? Here's your scenario. You're caring for a postpartum patient 2 hours after delivery. She suddenly complains of feeling dizzy. Her blood pressure is 82/50. Her fundus is firm. So which nursing action should you do first? Okay, so this is our priority. Are you going to A, check the patient's vital signs again in 15 minutes? B, assess the patient for signs of bleeding? C, elevate the patient's legs and give oxygen? Or D, call the provider to report the low blood pressure? So I want you to take a second. Think about it using the ABCs and the SAFE acronym, remembering what I said a little earlier about what you need to do first. So the answer, drum roll please, the answer is B. Assess the patient for signs of bleeding. Why? Well, because this addresses circulation first. Safety first. This is the priority action. ABCs are to check perfusion before you take supportive measures, or definitely before calling the provider. So that is the correct option. Why isn't it check vital signs in 15 minutes? Well, you're waiting. That's unsafe. Hypotension could indicate circulatory compromise, so delaying could actually harm our patient. Remember, we're trying to keep our patients safe. And why is C wrong? Elevate legs and give oxygen. Usually we want to give oxygen, right? But it says elevate the legs and give oxygen. I mean, that would help, but you have to assess first, right? You could follow with this after you've done your quick assessment, right? So you want to assess first before action. And then option D, call the provider to report the low blood pressure. Well, sure, it's important to call the provider, but you have to assess those findings in order to report. So if you call too early, it's premature. What would the provider say? Right? What have you done? Have you assessed the patient yet? So that's why. That's how we can answer those type of questions. So what's the teaching point? The teaching point is to always apply your ABCs first. Okay? Circulation is at risk in this scenario. So then use the SAFE acronym. That's going to guide your decision. It's safety first, then assess, focus on your patient, and evaluate your outcomes. You can't go wrong. Okay? So the next time you're stuck between two good answers, remember SAFE, Safety, assessment, focus, and evaluate. All right? And then for those OB questions, always ask yourself, what threatens the ABCs first, right? How am I keeping my patients safe? So that's it this week, guys. Thank you so much for joining me for this episode of OB Clarity with Dr. Godfrey. As I said, 11 episodes in. Thank you guys for sticking with me. So if today's tips helped you, share this episode with a friend who's also studying for their nursing exams. Let's spread clarity and confidence one student at a time. And if you're ever unsure what to do next, just think safe. So until next time, stay confident, stay compassionate, keep finding clarity in the care that you give. And remember, always assess, don't guess.